So you need to bookmark this in the UMedico app, set up a reminder until you are done with it, you can unremind it. So circle is 3 years, square is 4 years, triangle is 5 years is what you have to fundamentally remember. A 7-year-old, intermittent claudication, pain and weakness of the legs, dyspnea on running, delayed femorals. A very, very important clue. Punch your answer, doctor. With a delayed and weak femorals, left ventricular forcible pulse, Samsung absolutely rocks. Rituraj also, that it is coarctation of aorta is what you need to remember. A 7-day-old baby complaining of diarrhea, examination shows cataract in both the eyes and also jaundice. Jaundice, cataract, diarrhea, vomiting, what does it remind you? Question number 14, classical, on telephone only, listening to these 4 things. As a pediatrician, you should say, my first diagnosis is this. What is that? Absolutely, Rituraj rocks. Galactosemia is what you need to remember. Shika Munka, clean bold. Shika Munka thought cataract hai na, isliye rubella. But how will you explain jaundice with rubella? Shika ji. Huh? So, absolutely right. How do you treat post-infectious demyelinating polyneuritis? The Guillain-Barre syndrome is what you have to be very sure. Question number 15. Yes. Should you answer, doctor? 15. Classical question. अगर ये भी wrong करे तो मैं free coaching दे देता हूँ. Sean Chaco, you deserve a free coaching. Yes. Anybody else? Good. IV immunoglobulins and plasmapheresis. There is no role for corticosteroids in Guillain-Barre. Many times we discussed, you should not do this wrong with only 1 month with the exam ahead of you. Lymphocytic pleocytosis, low chloride levels and elevated protein in the CSF. Now this question for sale. 21, shoot your answer, doctor. One strong answer. Lymphocytic pleocytosis, elevated protein, low chloride. What do you like to answer this as? 21. Yes. Rocket Trader thinks SSP. Oh, come on, Rocket Trader. A known devil is better than an unknown devil. That is an important principle. What is? हम क्या बोले आपको? हम इस देश के वासी हैं जिस देश में टीबी बहती है. So जब tuberculosis ऑप्शन बी में है और आप tuberculosis मिस हो गया, you missed भारत रत्न अवार्ड, is what you have to be doubly sure about. Classical question, doctor. Lymphocytic pleocytosis, low chloride, high protein. Turner syndrome में you have a webbed neck, cubitus valgus, shield chest, not a polydactyly is what you need to remember. What is a steroid sparing drug that you use in case of the nephrotic syndrome? Levamisole, cyclophosphamide, mycophenolate, mofetil. They're all the ones which are the alternatives of the steroids is what you have to basically remember. Now in childhood ALL, these are all good prognostic except one. अगर इसका आंसर wrong करे तो I will get a heart attack, ST segment elevation with a coving like a brugada. I am going to get a heart attack if you don't answer this. Question number 24. Shoot your answer, doctor. Question number 24. One loud answer. Ritu says hypodiploidy. Om Prakash, Monica Sharma, Rocket Trader. Oh, आप लोग मुझे मरने नहीं दे रहे, right? Absolutely rocking. So you should not forget once more this slide you have to bookmark in the UMedico app and set up a reminder to repeated reminder, right? So WBC count less than 10,000 is favorable. More than 2 lakhs is unfavorable. Female gender is favorable. White child is favorable. The lymph node liver splenomegaly, if it is there, lymphadenopathy, hepatomegaly or splenomegaly. then it is very unfavorable if it is there in ALL. Testicular enlargement is unfavorable. CNS involvement is unfavorable. FAB type L2 is unfavorable. Then don't forget this, doctor. T1221, TEL amli, then trisomy 410-7, they are good for ALL. But T922, BCR, ABL, T411 and MLL AF4 are considered to be the unfavorable. Cloidy, don't forget, while taking the NEET PG exam, और एक क्वेश्चन आएगा ALL के prognosis के ऊपर का ये टेबल के ऊपर से. You have to mug it, assimilate it, drink it, and then reproduce it in tomorrow's exam. Hypodiploidy is unfavorable. Hyperdiploidy is considered to be favorable. And time to remission less than 14 days is favorable. More than 28 days is considered to be unfavorable. In a sutured surgical wound, the process of epithelialization is completed within how much period of time? 48 hours. Once more, doctor, wound healing is one favorite topic of the examiner. You will do amputation, debridement, decompression in all these clinical settings, except where? Use your common sense and shoot your answer. 26 for sale. Where you don't use amputation, debridement like a major decision is an important question. Shoot your answer, doctor. Right. 26, 26, 26, question number 26, not 25, 26. Very good. Rocket Trader says D and Sean Chaco says B. Chaco simply rocks in common sense. I say questions होता है डॉक्टर, पढ़ने से आंसर करने वाला क्वेश्चंस नहीं है ये. Situational common sense की इस्तेमाल करके you have to answer this kind of questions. Be very sure. INICET is on the top of the common sense, which is uncommonly available, but abundantly available with INICET. Acute thrombophlebitis में amputation क्यों करते, right? Now, facultative anaerobe is which organism? 27 for sale. Should your answer? Which is a obligate anaerobe, facultative anaerobe, similarly facultative aerobe. All these things you should be 100% sure in microbiology. Ilias bolta hai E. coli. Sean Chaco says bacteroides. Karthik also is conquering. You're all locked up with B versus C. Escherichia is the one which is considered to be facultative anaerobe.